Hey everyone, just a video today about joint health and movement. Now, many people associate aging or getting older with stiffness, degeneration, arthritis, and we want to try and break that myth because, quite frankly, it's not necessarily true. The number one thing that anybody can do to help their joints is move them. Joints rely on movement for health. They use movement to change pressure inside and outside of the joint to move fluid in and out. And it's this movement of fluid in and out of the joint that gives it its health. Because cartilage relies on tiny molecules called chondrocytes. And chondrocytes are the cells that give the joint the nutrition that it needs. So we want to try and flush the joint with as much movement in and out as best we can, consistently. What I'm saying is, if you aren't spending at least 10 minutes per day, as soon as you are, say, even kind of 30 or over, on joint mobility work, then over time your joint movement will decrease. It's as simple as that. Because of the nature in which we live, how often do we require the need to put our shoulder overhead or create a circle through our shoulders? We just don't. We may reach up into a cupboard once or twice a day, and that's it. We're not as active as we have been hundreds of years ago. And so we need to spend a little bit of time mobilising our joints, because it's no wonder we feel stiff in them, because we don't use them. So what you need to do is find a routine that works best for you. It can just be 5 minutes. It really does make a massive difference. Ideally 10 minutes or so would be great, but the key is every day. Only because we need this movement of fluid for the chondrocytes to improve joint health and nutrition. The best thing to do for joint health is to use circles. Circles are great because they basically use all of the variation of movement to that joint, the ability of that joint to move in all directions. So really simply, what you can do is you can start just with neck circles. You can just do 10 and 15 for each side. Something to note is that for every decade that you become older, you should be doing more. So if you're at, say, 30, maybe you get away with just doing 10. But then when you're 40, you need to do 20. 50, maybe you need to do 25. And so you need to do more and more and more as you age to maintain that joint health. It may be that in the beginning you can only do 10, but then you need to build up over time, slow and steady, until you can get to a much higher number, find out what works for you and go from there. So you may start with neck circles, You may move to shoulder circles through here, both kind of 10 go backwards and 10 go forwards. The idea being that the shoulder is tucked into the ear as best we can. For many people, they may only be able to go through here, but after maybe even months of doing this on a daily basis, they will eventually find that they can reach full range. It's not something that you can just change overnight. It will take time. You can then move the shoulder blades in circles, both forwards and backwards. You can move them in circles in this direction. You can move the elbows, both here, or you can just do one, and wrists. Okay? Hips and pelvis, you can just do nice big circles. Really simple stuff. It doesn't have to be complicated. Or you can take the hip, if you can see, and just rotate the hip in and out. Or you could just rotate the spine in this direction. And again, it's all about repetition. The higher the number you go, the better. It is just a numbers game with this, unfortunately. With the knees, you can, if I lower this a little bit, you should be able to see. You can do circles around the knees, and then with the ankles, you can simply do circles around the ankles. You can use any mobility exercise you like. This is just one variation, one simple example of something that you can do. The fact is, you need to be doing it every day as you get older to maintain joint health. The more the better, and look out for the videos for more variations.